Hi, my name is Lauren Masi. I'm a doctor of physical therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director at Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about preventing hip surgery with physical therapy. One of our main goals in physical therapy is to get you back to function as quickly as possible. When it comes to hip surgeries, they're usually falling into one of two categories. It's either usually something that's traumatic and maybe sports related, like a labral tear repair, or it could be a last resort after long-term wear and tear due to hip arthritis, which could lead to a hip replacement. One thing I always tell my patients is if you begin to have pain and it's not improving after about a week, I do want you to reach out to a medical professional so we can try to get a jump on it before any compensations become evident. Our body is very good at getting the job done. But however, this could result in your gait changing, meaning you're going to start to walk a little bit funny. You might not even start to notice it at first, but you might have a family member or friend who notices that you're limping a little bit and points that out. Also, whenever we have pain and inflammation, our body does one of two things. It makes your joint or muscles tight so that they can't move very much, or weak so that you can't move very much. And it's our job to let the body know if this is actually a safe and appropriate reaction or just a compensation that we need to nip in the bud as quickly as possible. Some of the symptoms that people report when it comes to hip pain could be pain that gets worse with prolonged walking. It could be climbing stairs. You start to feel very weak and you're pulling yourself up that railing. Sometimes you might feel inflammation in the groin area or out on the side of your hip. If you notice in the hip model, the hip joint actually sits in the crease. A lot of people feel like your hip joint sits on the outside of your thigh, like when you put your hand on your hip, but it's actually in the crease. So, we use this type of information in physical therapy to help determine where the pain is coming from. Is it a soft tissue? Is it a joint? And some of the ways you describe that pain to us can help guide us in the right direction. Also, the things that limit you at home can guide us in the right direction. So, do you have difficulty getting dressed, standing on one leg, or maybe getting in and out of a car seat or out of your chair? You might notice, oh, I feel very stiff in that hip crease, and then I can stand there a second or walk it off in a couple steps and things start to get better. These are some of the signs that you might have that I do want you to take action on sooner rather than later and get yourself into a physical therapy office for an evaluation and treatment so that we can look at the muscles and the joints, check that flexibility and strength, look at your alignment to make sure you're not contributing to any wear and tear that could lead to arthritis or that hip replacement surgery. On the flip side, I certainly have my runners, marathon runners, ultra marathon runners, who maybe through chronic wear and tear have worn their labrum, which is the cartilage that lines that socket in the ball and socket joint. They might be a candidate for a labral repair at some point. So hockey players are another one I often will see that have labral issues. But either way, we want you to be as strong as possible if you do have to lead into surgery, so it will never hurt to be proactive and try to address the issues before and prevent surgery to begin with.